Hey y'all, and welcome back to my channel. On this page, I talk about technology and money. If you're new here, please like and share this video and also subscribe to the channel. Liking and sharing the video does two things. Number one, it helps this content reach more people, so you are actually creating value. And then number two, it encourages me to continue creating content that you all find helpful. So today's topics are the top 5 technology and money stories of 2021. So these are my top 5 technology and money stories that really caught my attention, really made me pay attention and really think about how either in the field of technology or money, it really is impacting the culture, impacting the consumer, impacting patients. I'm really big on building generational wealth for myself and for my family. And then I'm also really interested in technology from the consumer standpoint, both in healthcare technology and also consumer technology, and how that can impact or change our lives. So I love technology stories. I love stories about money. I eat them up. I do subscribe to a lot of different newsletters, news feeds, their websites, and social media pages of various companies that I check on a regular basis. I also get my information from stories that people share on social media, or that people like email me or text me. So I would love to hear, after I give you all, or as I'm giving you all my top 5 stories that really made me pay attention this year, I would really love to hear from you on what were the stories in technology and money that really made you pay attention. So like 2021 admittedly was like, it was a year. I know it was a year for me. It was a year for my family. So I'm really hearing about and learning about different ways that technology can make our lives easier, or things that I can do to hold on to my money or my family's money and help circulate it more wisely. I'm all about that. So I'm gonna leave a link to all the stories that I'm going to share, articles that I'm going to share. I'm going to leave a link below. So you can go and read and learn about them for yourselves. And then also I'm going to leave my contact information if you'd like to reach out to me. So thank you also to everyone who has shared my videos over this year, written in content or ideas, or left comments on various social media pages. I really do appreciate it. Okay, so top 5 stories. So story number 1 that really made me pay attention was the story about Dollar General. So over the summer, Dollar General hired its first chief medical officer, and their goal is to become a healthcare destination in rural areas. And I thought this was really impactful, especially for rural healthcare. Over the past couple of years, hospitals and health systems in those rural areas have closed down, and consumers and patients now have to travel much further for basic health care, sometimes 20, 30 minutes, sometimes much longer. So Dollar General, as part of this news story, said one of their plans is to make a push into healthcare, which is really interesting. We've seen that over the years with CVS coming with CVS Health, Amazon, Google Health. So we're now seeing a push for more and more retailers getting into healthcare. So they said they're inspired by, they being Dollar General, are inspired by customers who want more affordable healthcare products and services. And one way that Dollar General went ahead and started making an impact in this field is becoming a COVID test site. For some of these rural areas, they're now starting to add more fresh produce and meats to their stores. And this is really interesting as well, because not only have hospitals left, as they have shut down in the rural areas or merged with larger health systems. What went along with that in some areas, I know the rural area that my family is from, that also included the larger grocery stores. And in a lot of these towns and municipalities, consumers only have access to like a Dollar General. So Dollar General is looking to not only add more healthcare products, but also services. They haven't really talked about yet what services they're going to add beyond like the COVID testing, but they will be adding more. So that really made me pay attention in terms of what that's going to mean for like as healthcare providers like myself, for the world of telehealth, what it's going to mean for infrastructure if they start adding more services or clinics like CVS Health did. If they do add those type of services, what that's going to mean for advanced practitioners such as nurse practitioners or physician assistants. So yeah, so this Dollar General story really made me pay attention. Number 2, this one is in the field of money, but specifically for Black women, and that's how I identify. And so Goldman Sachs, so this was a big one. So I saw several articles this year with more companies investing in Black women, and I'm really interested in as more and more stories come out. So Goldman Sachs launched the 1 Million Black Women Initiative, and they're committing $10 billion. That's a B, capital, in investment capital and $100 million in philanthropic support to advance racial equity and economic opportunity by investing in Black women. So this is interesting. So they're partnering with Black women-led organizations. They have conducted listening sessions with over 12,000 women to really understand the needs of these women and what they need for their communities and the things or the investments that will really make a difference in these communities. So some of the investment capital they've already started doing in partnership with organizations. Several of them focus on Black women maternity health. So, Black women disproportionately suffer more from birth-related deaths than any other backgrounds. So they are invested in Goldman Sachs, the Birth Equity Center. They're getting a grant to support women and community birth centers with resources, sustainability and growth. There's also the Center for Maternal Health Equity at Morehouse down in Atlanta. They're receiving a grant to address disproportionate maternal mortality. And this is something that I learned, that 60% of maternal deaths are preventable. That's really, really high, right? Because women really shouldn't be dying in childbirth. There's another organization called Block Power Wi-Fi to invest in broadband, because broadband goes back to like number 1 with the infrastructure piece. That affordable broadband can really impact or lead to barriers if it's not there in education, employment, banking, social network, healthcare is number 1. So that's really, really big. There's a Collab Capital Fund that's investing in Black women founders who have innovative high growth companies. So this was interesting. This is something that I've known for many, many years, that Black women start businesses at the fastest rate of any demographic, but they only receive 0.27% of venture capital funding. So there's definitely an equity gap. So that's a really interesting, and tied into that, not only is Goldman Sachs investing in Black women, so just on, I believe it was Wednesday or Thursday down in Atlanta, they have a new program that is for women in certain areas and income gaps will, for over a period of 2 years, receive $850 in guaranteed monthly income to help improve themselves, their families, their communities. So yeah, there's really been a rise in the last few years of these companies investing in the community. I would love to hear from some sociologists on why the dollars are being driven in that area. And I'm sure there's some science. People don't just invest billions of dollars into someone or a community without some real thought behind it. So I found that very interesting. And that goes back to one of the goals, not only for myself and my family, but just for everyone to be able to enjoy generational wealth and pass that money down. So number three was a big one, y'all. This was a big one for our area. I'm in the Raleigh-Durham area. So Apple is coming to North Carolina, right? So this was huge Huge. People are still talking about it. This happened way early in the year. This was like within late first quarter, second quarter. So Apple has chosen the Research Triangle Area, or RDU, that some people call it, to build their East Coast hub, right? So they're investing $1 billion in this hub. So that's going to mean jobs, and not just only engineering, but also networking and project management and construction and lots of jobs. And so one thing I have found really interesting and I've seen ramped up is companies that are already established here are really ramping up their retention efforts, right? Because what we don't want, or what these companies don't want, is brain drain, right? Increased attrition. The demand for tech talent in this area is just like through the roof. So as someone who works in tech, I'm a registered nurse, but I do work in tech. This is an incentive to keep my skills sharp and just have a better understanding of the market, but also for companies to start thinking about when these jobs come, because it's going to mean over 3,000 jobs for this area. It's like, what can you do to attract talent, tech talent, but also retain the tech talent that you already have? So that was like a really, really big story and made me pay attention. Okay, so number 4 is the increase in Black-led technology businesses tackling health equity. So I always talk about, I've done several stories on how representation does matter. I've did several posts on that. And within the healthcare industry, if you have been a consumer, even if you work, no matter what anyone says, there is implicit bias that some providers have, or there are things built in systematically that leads to inequity. So there are four companies. There are many more. So there are 4 here I'm going to mention that are tackling health equity. One is Health in Her Hue, which is an app. It's a website that helps Black women and women of color to connect to culturally sensitive medical providers. It's based in New York. There's also Hurdle, which is also it's focused on mental health, and it aims to connect Black patients and people of color with therapists. Mental health is so important to understand and honor culture, because again, representation does matter, and it does help sometimes to talk with a provider or meet with a provider who understands those cultural differences. It can make a difference for some patients in their outcomes. Then there's MedHall, that's based out in Memphis, that provides an inclusive and low-cost transportation for patients to get to and from their medical appointments. And so it was founded with low-income rural residents in mind, which ties into the first story that I talked about with Dollar General investing in rural communities. So that's really important. There's Clinify Health, who targets underserved communities to help physicians and medical professionals target the patients who are most in need. And they're doing what they're doing using analyzing social data and also medical data. So yes, I'll definitely leave a link to this story. So yeah, we're seeing in it, there's always been Black tech founders out there, but it's really interesting to see the rise of these companies that are working really diligently to tackle the racial gap and inequity in healthcare. So the last story, now this was a big one for me. As a registered nurse, I know also the nursing unions jumped all over this. I've seen stories there. I've seen pros and cons. And the last one, y'all, tech and money story that really caught my attention this year is the rise of the hospital at home. So this was huge, right? So this was born out of I believe John Hopkins trademarked the hospital at home, but it really rose out of needs around the last 2 years and the Panosaurus Rex that's out there. I can't say the word here on YouTube, but this is a new way for patients to receive healthcare not in a traditional hospital environment. Oh wow, this was interesting. So hospitals will add capacity at the height of what was going on over the last 2 years. There were already many home health care services out there, but it wasn't too many companies or no companies out there really doing and setting up hospitals at home. So the benefit to this, there's definitely some advantages. There's like lower lengths of stay. Apparently the research around hospitals at home, patients have better health outcomes. It benefits, of course, the patients themselves. There's cost savings on average of 19 to 30% compared to traditional inpatient care. Isn't that interesting? So people having better outcomes and better costs versus being in a traditional hospital environment. And it also lower rates of mortality, higher patient satisfaction and patient experience. So yeah, I'm sure I know there are health systems in my area and then other larger health systems out there that are investing in these type of programs as well. So yeah, y'all, those are my top 5 technology and money stories of 2021. I would love to hear you all's thoughts. Any stories that you have of technology and money stories that really stuck out to you this year, you can share them in a comment below to me. I always love to hear from you all when you write into me. I will leave my contact information in the description box. And please do, if you made it this far, like and share this video, subscribe to the channel, and I'll see you in the next video.